Good morning. My name is Lani Lawson and I'm the Community Animal Care Educator with AMRRIC. AMRRIC stands for Animal Management in Rural and Remote Indigenous Communities and is based in Darwin on Larrakia Country in the Northern Territory. Firstly, I would like to acknowledge all First Nations people on the beautiful lands in which we live and celebrate their enduring knowledge and connection to country. We honour the wisdom of and pay respects to elders past and present. I am honoured to reside and work on Kabi Kabi country in Queensland. I would also like to thank Getting to Zero Summit for hosting this event and allowing me the opportunity to present on behalf of AMRRIC. AMRRIC is a national not-for-profit organisation that works with Aboriginal and Torres Strait Islander communities to coordinate and facilitate companion animal health and management programs, incorporating One Health principles, which takes into consideration the health of pets, people, and the environment. Our team delivers culturally and contextually appropriate veterinary services, training, and education programs to rural and remote Indigenous communities across Australia. We aim to empower communities and local stakeholders to address their animal health and management needs, driving improvements in the health of communities as a whole. In the theme of equity and access, inclusive solutions for companion animal challenges, I would like to discuss how we can empower pet lovers, owners, carers, and those without pets to be a part of the solution. My presentation today will focus on school-based animal health education programs and their role in promoting responsible pet ownership. Firstly, I would like to discuss the challenges faced in Aboriginal and Torres Strait Islander communities in managing companion animals, how education programs empower communities and promote responsible pet ownership, how the education programs are designed and delivered, the importance of collaboration and partnerships, the benefits of coupling education with veterinary services, and then we'll have some time for questions at the end. To understand the necessity of education programs, it is necessary to first understand the characteristics of pet ownership in remote communities and the challenges faced. These challenges include geographical remoteness, seasonal inaccessibility, commonly due to flooding, inadequate funding for animal management programs, and the broader social determinants of health. All of these factors result in limited access to animal health services and products. Additional complexities arise from factors such as inadequate council bylaws and bylaw enforcement, the absence of fencing enabling animals to roam, as well as cultural perspectives on free-ranging animals. These challenges lead to numerous animal management issues. Overpopulation, which feeds directly into many animal health concerns that are commonly raised. Where there are entire dogs and cats that are allowed to free roam, large number of puppies and kittens will be born, leading to unwanted animals. This results in negative welfare outcomes for the animals, as the community's capacity to adequately care for each individual is reduced as the numbers grow. Fighting. With larger number of animals, there can be increased competition for mating, as well as resources like food, water, and shelter. This can create safety issues for pets and people, with dog bites and dog attacks becoming more likely. This can make residents and visitors feel unsafe within the community. Untreated injuries and disease lead to animal suffering. This is a challenge anywhere without access to veterinary services and is distressing for owners or anyone witnessing a pet suffering. Unobtainable prophylactic treatments, unable to be obtained either geographically and/or financially, can lead to heavy internal and external parasite burdens and the suffering that follows, as well as human health risks with some parasites being zoonotic. Zoonoses. There is a greater risk of exposure of people to zoonotic diseases with overpopulation. The cat pictured here has ringworm. Increased nuisance behaviours. Noise from vocalizing, barking, yowling, fighting, and mating. as well as knocking over bins looking for food, which can cause hygiene issues. And of course, free roaming animals deposit feces and urine around the community, which increases health risks. As you can see, there are unique challenges to animal management in communities that lack access to preventative animal health services. Educational outreach is an impactful method of provoking change. Our goals within education are to address the challenges previously listed by equipping people with knowledge. Education programs aim to promote responsible pet ownership by teaching children about caring for pets, including their physical and psychological needs, including safety around animals and behaviour. Improve animal welfare outcomes by building empathy towards animals, encouraging kindness and ethical treatment. Encourage preventative care with lessons centered around pets' needs, common parasites, antiparasitic medications that are available, vaccinations, and the benefits of desexing. Encouraging proactive use of antiparasitic medication, reducing those parasitic burdens and sickness, and encouraging pet owners to seek out veterinary services when available. Reduce zoonotic disease risk, education around common diseases, zoonotic parasites, and the modes of transmission and avoidance techniques, contributing to safer interactions between humans and animals. Encourage interest in animal careers, exposure to animal health lessons, veterinary work, animal management workers, and our project partners' professions, such as environmental health workers, can inspire students to pursue work within the animal care fields. Enhance cultural attitudes towards animals. School education helps shift perspectives, influencing broader cultural change over time. Stronger disease surveillance and biosecurity. Educated individuals are more likely to recognise abnormal animal behaviour or symptoms that may indicate outbreaks of disease. Stronger disease surveillance and biosecurity supports veterinarians in detecting, reporting, and managing contagious or zoonotic diseases. There are a lot of considerations for the topic and material used to teach, and we require information from the schools to plan accordingly, such as class compositions and the age ranges within classes, keeping in mind that remote community schools are often mixed class schools, meaning you'll have students of different ages in the one class to cater to. The geographical location, where are we delivering the lesson? Do we have images of people, community, or surrounding environment of this area? Are there specific considerations for this area? For example, if teaching about cats and their hunting ability, what native animals are present in the region? Cultural appropriation. There are areas where we work where domestic animals are associated with Dreamtime stories, which may impact the treatment of pets and also what we can or cannot promote. Aim of the education program. We need to consider what is the goal of the program. What are the desired take-home messages? Keeping in mind what is actually likely to be achievable for the residents in the community. Our programs are designed for students from kindergarten to high school. The majority of our materials are suited to primary school, though we are always creating materials to further expand upon this. The use of colour and imagery is important in engaging young and linguistically diverse learners, as well as region-specific content where possible. And the lesson content and activities change based on the year level. The lessons have been developed guided by the common issues witnessed or reported on in communities. Some of our lesson topics include staying safe around dogs, pets' needs, parasites, reproduction, and empathy. We have a large array of resources, and typically more than one is used as part of delivering a lesson. Our resources include PowerPoint presentations, animations, music videos, books, posters, activity sheets, and games. By having multiple resources used in a lesson, it increases the likelihood of one or more of these resources appealing to the students to achieve the desired learning outcome. It also increases the inclusivity by appealing to multiple learning styles. Our PowerPoint presentations are used to complement an activity and provide additional information, incorporating photos and videos as well. Animations. Our newest animation is Informed Consent, which addresses the topics: what is desexing? Why is it good to desex your pet? What are the risks of desexing? Required aftercare following the procedure. Another very moving animation is empathy. You feel, they feel, we feel, which teaches and demonstrates empathy towards animals for young children through the showing of a sweet and simple story about a boy and his dog. We also have animations about cats on country, ehrlichiosis, tick sickness, and baby animals belong in the bush. Music videos. AMRRIC, in collaboration with Grand Train Creative and residents from Fink and Yearly, have created 2 music videos that encourage participants to engage in both thinking about responsible pet ownership behaviours, as well as the creative process involved in making these music videos. We have 2 books that have been created: What Wally Needs, which tells the story of a lovable dog who has been left home alone and his adventures to find the necessary resources to survive whilst his family are away, highlighting the importance of ensuring our animals are taken care of when left alone for long periods of time. The second book is Bacon and Eggs Visits the Vets, which follows the adventures of a young girl and her dogs Bacon and Eggs and their 7 puppies. The story highlights the impacts of having too many dogs on our mental and physical health and the benefits of having our dogs desexed. Posters. These can be provided at any time, and usually our partners will assist in distributing these, and they can be very helpful in advertising upcoming visits to increase engagement and provide information in another format. Activity sheets. These are usually used at the end of a lesson or left with the class following the lesson. The students can take these home and share them with their families. Games and activities. We have numerous hands-on activities for students to participate in. I would like to highlight a couple of our cat educational resources here. The first image on the left is Guess the Kittens in the Jar, which the number of kittens in the jar is approximately how many kittens one female cat could produce in 1 year. This is a fun guessing game for the students. Images in the middle and the far right is our cat breeding mat, which demonstrates the breeding and hunting capability of cats and is used as part of our cat reproduction lesson. We start with one adult female and male cat, which is represented by the larger size cat heads in pink and blue. The students then roll a dice, which advises how many kittens and of what gender the female cat will have. We then place the smaller cat heads, which represent the kittens, on the mat. As time goes by, we discuss as a class that the kittens are no longer small and soon will be able to have kittens of their own. We have a lot more cats than when we started, and all these cats are going to get hungry. We discuss as a class that they will go looking for food and possibly what they will eat. We then pack away some of the birds, lizards, and butterflies on the mat. Repeat the dice roll, the breeding cycle 3 times, and count the number of cats we've ended up with at the end, noting the number of animals that have been eaten. Veterinary programs. Coupling education with veterinary services increases the awareness of available services, what community members can expect from their veterinary providers, subsequently increasing the uptake of veterinary services. AMRRIC also encourages visits to our clinics. This can be children or adults, and we're very happy to answer any questions visitors may have. Hands-on experiences. Where there is interest and providing the appropriate safety measures are in place, we'd love to have participation in our veterinary programs. You can see in the images here, we have young visitors learning how to locate and count a dog's heartbeat. A student is clipping the fur on a dog that will undergo surgery as well. These hands-on experiences are exciting and memorable for the students, and in the long term can contribute to the assistance we receive in the community, as well as encouraging working in animal health related fields. Collaboration and partnerships are integral to the work we do. They build capacity within the community, where local people are trained in lesson delivery, enabling lessons to be taught without the presence of AMRRIC staff, and we can provide the resources and ongoing support remotely. Enable the lessons to be tailored based off local knowledge. In many areas that we work, Aboriginal languages are widely spoken, and by partnering and creating these lessons together, They can be taught in local language, increasing the relatability and understanding of the content. We rely on our relationships and invitation into communities and schools to deliver this information. Many of the communities we visit require permissions via land council permits. Additionally, the lessons are not part of the curriculum, they are an extracurricular activity, so this relies on the school having interest and availability to facilitate a visit. The teachers are also present for each class. Normally they have an existing relationship with the students, which really helps, and we also welcome any assistance with delivering lessons. School-based education is a foundation for sharing of information, as it is often further disseminated and shared within households. This expands access to this information and contributes to social change in pet ownership, building healthier relationships with pets, ultimately leading to healthier communities. If you'd like to know more about AMRRIC or get involved, you can follow us on Facebook or head over to our website to subscribe to our newsletter, sharing tracks, donate, or register your interest in volunteering. We also have an array of resources available to download from the website, and you're also most welcome to get in touch if there is a specific resource you are looking for. Thank you all for your time today, and I would love to welcome any questions or comments you may have.